Kushe, and good evening, everyone. This is Jon Lascher from Partners in Health, Sierra Leone, and today is Tuesday, April 21st. 7 new coronavirus cases were confirmed in Sierra Leone today, bringing the total number of cases in the country up to 50. Most of those cases are in Freetown, though there are 3 cases in Kenema and 1 in Tonkaluli. Around 40% of all of the confirmed cases in the country are healthcare workers. I wanted to let everyone on the team know that last week, Dr. Paul Farmer, Byler, Momo Jimmy, and myself spoke with the president of Sierra Leone, President Matabio, and the Minister of Health, Alpha Wari, to discuss how Partners in Health could get more involved in the national coronavirus response. President Matabio asked Partners in Health to do 2 things. The first was to take lessons from our work in America, where we're hiring 1,000 contact tracers to help get ahead of the virus in Massachusetts, to take lessons from that plan and bring them to the national contact tracing plan in Sierra Leone. The second was around supporting the laboratory pillar to find ways to bring more laboratory tests into Sierra Leone. Both of these we are committed to helping and supporting the government of Sierra Leone. We know resources are limited, but we're going to try our best to help launch a national contact tracing initiative in collaboration with the Emergency Operations Center, the Ministry of Health, and also all of the districts and district health management teams and district emergency operations centers around the country. Now, the plan around contact tracing in Sierra Leone, part of it is based on the work that we're doing in Massachusetts, but also the work in Massachusetts has been informed by the work we did as an organization here in Sierra Leone during the Ebola outbreak. And I wanted to bring on the Chief Medical Officer for Partners in Health, Dr. Joia Mukherjee, who I know many of you have met on her many trips to Sierra Leone, to explain a little bit more about what's happening in Massachusetts and how that work is linked directly to all of our efforts in Sierra Leone during the Ebola outbreak.
Hi, everyone. This is Joia Mukherjee. I'm the Chief Medical Officer of Partners in Health, and I'm really happy to be talking to the folks in Sierra Leone today.
Thanks, Joia. And I will say, as we get started, my mom has been watching you on different news networks and every time sends me video updates. So she's going to be very excited to listen to this.
All right.
So you've been working at PIH for 2 decades now, maybe over 2 decades now,
Yeah.
all around the world. And can you tell us a little bit about sort of what makes the coronavirus pandemic different than some of the other epidemics you've fought over the years?
Yeah, so, I think Partners in Health has been around for 35 years, and we know that epidemics always affect the most vulnerable, and so that's one of the reasons we've had a lot of focus on infectious disease, like HIV and tuberculosis, Ebola, cholera. This epidemic is really, truly a pandemic and is affecting people in every country in the world. And that makes it a little different because there's a spotlight on the disease, even in Europe, even in the United States. And often it's hard for Partners in Health to get enough attention to bring resources into the diseases we fight if they're only in more impoverished countries. But in this case, it's everywhere. So that is easier for us on the communication side. Everyone understands how serious this is. On the other hand, it does make it harder because countries are scrambling and fighting against one another for resources like personal protective gear. So the other pandemic that we've been involved in, HIV, also had this disparity where only wealthy countries were able to get the drugs for almost a decade. But it was a little bit slower. So we have to simultaneously be helping people in the United States, but also really keeping our eyes on Sierra Leone and really trying to get resources for Sierra Leone and other countries in Africa and in Haiti and in Latin America. And so that really makes it different. The other thing about coronavirus is it's just highly contagious. And so like Ebola, it's very easy just being in close quarters to transmit it. It's even a little more transmissible because of the respiratory symptoms. And so we have to be really on top of contact tracing, which is something that allowed Sierra Leone to really do well in the fight against Ebola. And so that's lessons that we need to take from around the world about tracing every contact.
We were asked by the governor of Massachusetts to help do contact tracing. Can you talk a little bit about what the epidemic looks like in Massachusetts, why Partners in Health is getting involved in Massachusetts, and what that contact tracing strategy looks like?
Yeah, so one of the things we talk about a lot at Partners in Health is the comprehensive nature of our work, that our work is prevention and it's also treatment, that our work is taking care of the individual and really understanding the social forces. And unfortunately, the American medical system is not comprehensive. It really is focused pretty exclusively on treatment, not at all on prevention or public health, and not at all on the social forces or social determinants of health. So what we've seen is in the US, people are just waiting passively in the hospitals and then scrambling to take care of the sick and not doing any strategy to have prevention efforts and contact tracing. And so we were known for helping the government of Sierra Leone and the government of Liberia during Ebola, other governments for tuberculosis, HIV, cholera. And so the governor said, well, is there something that Partners in Health can help us with to track this epidemic down? Because he understood the need for a preventive strategy as well. So we looked at our notes and we understood what we all collectively had to do in Ebola. And in fact, we were specifically referencing Sierra Leone. As many of you remember, the last cases were in Tonkalili, and that those were successfully traced down by every car that went into Tonkalili, people had to get out, have their fever checked, wash their hands, have their names recorded, and eventually we got to zero. And that's the model going from Tonkalili to, as we say, Tewksbury, Massachusetts, Tonkalili to Tewksbury, that we're trying to deploy in Massachusetts. So, a lot of lessons learned from our collective work with the Ministry of Public Health and with the NERC and other groups in Sierra Leone that are being applied now in Massachusetts.
It's also valued and being recognized from the Minister of Health and the President of the country of Sierra Leone that, what's happening in Massachusetts right now is born out of partially the experience in Tonkalili and beyond in Sierra Leone. Yeah. So, and I keep saying, even though Sierra Leone is among the most vulnerable countries in the world, they're better prepared for this epidemic than, Massachusetts was in a lot of ways. But that being said, it's still, it's a really challenging time, and we're looking for ways to support national contact tracing here. What lessons do you think we should be applying in Sierra Leone that you're learning, as you're rolling out work in Massachusetts and the work you've done for 2 decades?
I really want to, again, just highlight the strong work in West Africa to end the Ebola crisis. And I do also note to my colleagues in Massachusetts and elsewhere across the United States that in February, I was in Sierra Leone with many of you. I was in Liberia as well. And in both places, I had temperature screening at that time. I was asked about travel history to China. My cell phone number was recorded. So, and then returning to the United States in February, there was no screening at all at the airport. And so I felt reassured that the heightened awareness and the systems that were developed and reinforced during Ebola were already at work. So amazing kudos to that. I also think that Sierra Leone in particular has done so much work in communicable diseases like Lassa fever. The great Dr. Khan, who perished during the Ebola crisis, is always remembered at these kind of times. But we've had small outbreaks of Lassa that were contained quickly. We lost our great friend Walter from the last Lassa outbreak, but there are systems in place that will stop these things before they spread. So we have to redouble our efforts in doing that. And I think the lessons learned between, going back and forth, the United States and, let's say, Sierra Leone are vigilance and surveillance are essential. That is what allowed us to rapidly control a Lassa epidemic in 2019 that only, I think, claimed, and every life is valuable, but claimed much fewer lives than it could have. And so that ongoing surveillance by fever screening, by symptom screening, by travel history is very important. I think the main thing that we've learned, though, across PIH, and Jon, of course, you've been a huge part of this for so many years now, is you cannot do control of infection without social support. It's not possible to just put people on lockdown if they don't have food and if they don't have work. So we've got to think of strategies that will allow the most vulnerable to survive and still take adequate public health measures. And so, how does that work? I remember one amazing story from my colleagues at Wellbody during Ebola in Kono district, when a family was identified with one person with Ebola. They happened to be lucky enough to have 2 rooms in their home. They separated the one person with Ebola. The rest of the family stayed in the other room. And our amazing community health workers from Kono and Wellbody came and delivered food to that house. They put it a safe distance away, and the family would come and get the food after the community health worker left. So there was no contact between the community health worker and the family. But it's that kind of thing, lessons learned, that are the most important lessons at this time. That control has to be about solidarity and protection for the vulnerable and not like a kind of policing. And how we get the balance of public health right and still protect the vulnerable is always going to be where Partners in Health puts our effort.
Amen to that. One question that keeps coming up here is just the availability of laboratory diagnostics and how quickly. Right now, there's a dwindling supply of PCR tests in the country, and there's, from a lot of the technical experts, there's some questions about rapid diagnostics, and there's some excitement about gene expert cartridges. And I know this is a little bit of a in the weeds question, but is there any movement you're seeing in a positive way or even a negative way around availability of diagnostics?
Yes, I think we're seeing a lot of new tests come up. We're going to see studies come up and be published soon about how rapid antibody tests and when and why we would use them. There are more sensitive antigen tests. There are even going to be tests that come up that use the perhaps saliva instead of the nasal swab, which will be easier. So I think this is rapidly evolving. And again, we did see that during Ebola times as well. If you all remember, there was just one centralized lab in the country, and over time those labs became decentralized, put in container laboratories and used with the glove box so that it was much easier to do it and remain free of contagion. And so I think that we're going to see that even more rapidly because of the fact that this is truly a global pandemic. And so Partners in Health has been working to try to get the rapid diagnostics for countries who want them. Both the antigen and antibody tests, not necessarily because we thought, well, certainly not because we thought they were a gold standard, but that we thought by putting our money into different sources that would create the demand and stimulate scientists and commercial labs to try to do more. So we tried to use our little bit of volume as an NGO to help shape the market. And that's what we've done with the new drugs for tuberculosis that we're now using in LACA. That's what we did with the cholera vaccine efforts that Jon really led in Haiti and in Sierra Leone. Sometimes just doing purchasing early on will send a signal to markets to ramp up and to scale and to try different strategies. So that's what we really hope to do with our early purchases of rapid diagnostics. And those antibody tests have proven to be quite useful in Peru and in Haiti where they're being used. But there will be other tests. And I think with this global pandemic, it's obvious the need is there.
And how do you see the pandemic evolving right now? I know no one has a crystal ball as to how this is going to go, but do you have any takeaways from where we are in this epidemic curve as a global society?
Well, the best case scenario is Rwanda, and we all need to learn. There's no country, in my mind, that has done this as well at scale nationally as Rwanda. We need to keep our eye on what they're doing, which is tracing every contact. The government is supporting isolation and quarantine with food, hotel rooms, etc. And they have had only 134 cases in the first month of the virus arriving in their country and have done thousands of tests. So we need to look at these ratios of how many contacts are traced, how many people are really able to quarantine, and that needs a lot of support. And then try to do as many tests as we can to really use this as a screening tool. And I know tests are limited. There may be a way to do this with a clinical diagnosis of suspected COVID. But I think we need to keep our eyes on the successes. We don't want to keep our eyes on the U.S. It's been a very much of a failure with no real public health strategy until very, very late in the game. So Sierra Leone has public health principles in place, and I'm hoping that those can immediately be deployed into the areas that are most needed so it doesn't spread throughout the country.
Yeah. What's keeping you motivated and energized during this period?
All of you. I mean, the collective efforts, I always think of Mukherjee and that sign in the front of the, collective efforts of Sierra Leone, Americans, the Cubans. This is the time we need solidarity. We need people to come together. And, I understand people's feeling of isolation and demoralization, but we're always a team and we're always in solidarity and we always can find each other, at least like we're doing today on the internet, and be together. And that's what keeps me motivated, that, we've got the best team in the world. This is the team I want to be in the fight with for the rest of my life. And, we're gonna beat this. But I think those public health principles we've all learned together in places like Sierra Leone should be at the forefront of this response.
Thank you so much, Joia. I really appreciate your time.
Yeah.
And thank you to all of you who've been listening to these audio updates. If you have ideas for other people to be interviewed on these audio updates, or if there's information you'd like us to cover, please let me know. Just reach out to me by email or WhatsApp, and I'll be happy to schedule those in. Hope everyone's having a great week so far, and we'll be talking to you very soon.